Lift up your chin. Sister, you're having an asthma attack. I need you to relax. Roll up your sleeve, please. I'll give you epinephrine. Open your lungs and help you breathe.
What happened?
Did she take the pill?
Yes.
It's probably an allergic reaction.
She's allergic to an anti-allergy medicine?
I figure somebody's out to get her. How are you feeling?
Better.
I'll put you on some steroids instead.
Is my heart supposed to be feeling so funny?
It's called adrenaline. Makes your heart beat fast. But not this fast. Get a nurse, please.
Help! Somebody help us!
Somebody get in here! Call a code in charge of the defibrillator. She's got no pulse.
How you feeling, sister?
I seem to be a little better. They gave me some medication.
Prednisone. It's a steroid to help with the inflammation.
Has Dr. House figured out what I have? Will I be okay?
We're not sure what's wrong yet. You'll have a chest CT scan this afternoon that'll help with the diagnosis.
Dr. House is giving her medication and he doesn't know what she has yet?
Trust, Sister Pius. It all happens for a reason.
What about you, Chase? You believe in God? I believe Sister Augustine has no vascular pathology, which means no Church-Strauss.
Which means House made a mistake.
No, not necessarily. It could be something else. Thyrotoxicosis or a carcinoid.
I don't get you. You don't believe in God, but you're willing to put complete faith in one man?
Please, the smell.
Let's get her out of there.
I'm coming, sister. I gotcha. I'm coming.
Oh, the smell. God, be sick.
There's no smell.
Oh,
It's okay.
no, God. Oh, it's Jesus. It's Jesus. He's coming for me. He's burning me with his touch.
Let's get her on some Ativan.
Oh, please.
Smells religious visions of symptomatic temporal lobe swelling. We don't want her to...
Oh, she's seizing. Trauma.
Help me get her on her side.
Religious visions?
Yeah. And next comes...
Do all of you lie? It's good strategy. It's simpler when you all tell the same lie. But she has not spent her entire life as a good Catholic. When she had a cardiac arrest, I had to open her blouse to do CPR, and I learned two things. Nuns can have nice breasts, and she has a tattoo on her shoulder of a skunk. Now, maybe it's the sacred skunk of Joseph. As far as I know, Catholic foster care and monasteries do not keep tattoo parlors in their refectories.
We consider that our life begins when we put on our habits and take our vows. What happens before then?
It's irrelevant to you, but it's relevant to me.
Sister Augustine went into foster care when she was 6 years old, but she left when she was 12. She lived on the streets. She got into drugs. When she was 15, she became pregnant, tried to self-abort. She lost the child. She became ill. We took her in when she came back. If we had thought it was medically relevant, we would have told you.
It's not. This tea is delicious. Local herbs?
Any change with the medication?
Yes, she's getting worse. Lung function's deteriorating, but UN and creatinine continuing to rise. She's starting to run a fever and the rash is spreading. At this rate, she's not gonna make Christmas.
Maybe House was right. Maybe there is an underlying condition that explains the symptoms, something we haven't considered.
Like what?
It could be a metabolic disorder,
Specifically?
like a genetic.
Specifically?
I'm just saying
You're just saying you think House is right.
I might be right.
Of course he might be right. It might be the hand of God at work. Don't say it's something else unless you've got something concrete to offer. What's this, hemlock?
I'm gonna do you the biggest favor one doctor can do another. I'm gonna stop you from killing your patient. It's figwort tea. Great for that little pick-me-up we're all looking for in the morning. Opens the lungs, increases the blood pressure, stimulates the heart. Unfortunately, if you then get injected with even 0.1 cc of epinephrine, instant cardiac arrest. Still, what the hell, it tastes great.
Sister Augustine.
Has been drinking it religiously, so to speak.
Take the cardiac arrest out of the equation.
All the rest of the symptoms can be explained by a severe long-term allergic reaction.
Well, that's what Cameron said in the beginning.
Yes, she did. Hold on. But your unwillingness to stick by your diagnosis almost killed this woman. Take a lesson from Foreman. Stand up for what you believe. Okay, let's go figure out how to save a nun.
Damned if you do, damned if you don't.
Because it's been untreated for so long, it's gone from a simple watery eyes, scratchy throat allergy to a whopping I'm gonna kick your ass allergy, compromising her immune system, diminishing her ability to heal, and breaking down her organ system. So, what's the source?
The dish soap.
No. Symptoms persisted days after the dishwashing episode. It's got to be something she's been exposed to here in the hospital as well as the monastery.
Well, what about the tea? It caused her arrhythmia.
It could be, but it's not definitive.
We'll skin test for allergens.
Not yet. She's too reactive. She tests positive to everything. We need to stabilize her, isolate her from all possible allergens, give her system a rest.
Get her in a clean room.
Okay, and we'll gradually introduce allergens and see how she responds. When she reacts to something, we'll know that's what's killing her.
We'll call you if anything changes. Will she be all right?
As long as she's not exposed to anything that can aggravate her allergies, she'll be fine.
Need some help in here? Smoothing procedure. She's in anaphylactic shock.
No way, she's in a damn clean room.
You kidding me? Get in here. 21 cc, Betty.
She's about to intubate.
I got it. Get the ambulance. I'm in. Breathing stabilized.
It's a clean room.
How do you get an allergic reaction in a clean room?
Maybe it was the preservatives in the IV.
Check that.
Latex tubing?
Check that. Check everything.
Well, it could be mast cell leukemia. It can cause anaphylaxis.
Check the blood levels. And it's not eosinophilia or idiopathic anaphylaxis.
Maybe it's just divine will. How'd it go?
She has God inside her. Would have been easier to deal with a tumor.
Maybe she's allergic to God.
Looked everywhere for an allergen that could be causing this reaction except one place, inside her.
On her medical history, she didn't mention any surgery.
She had one.
Can we get her records? What hospital was it
They
at?
didn't have it at a hospital. Order full body scan.
What if she refuses?
Tell her I'm looking for a miracle.
No piercings, no fillings, no surgical pins in the arm, no implants.
It's clean as a whistle.
What's that looking for? What is that?
Dunno.
Lock on it. Get a 3D representation.
Oh my God.
The copper cross, form of birth control, pulled off the market in the 80s.
So she's allergic to copper.
Rare, but it happens.
Wouldn't she know she had an IUD?
She had an abortion. IUD must have been left in, embedded in the endometrial tissue where it couldn't be detected.
So all we have to do is remove the IUD.
Then the symptoms should subside.
I got this IUD when I was 15. It's been more than 20 years.
Or prolonged exposure to an allergen with minimal symptoms. But at some point, all it takes is one last contact to cause a full-blown reaction. It's like a balloon filled with air, one last breath. It explodes.
The first time I got the rash was when I was washing the copper cookware.
And all your subsequent symptoms came from ingesting food prepared in it.
Dr. House found his miracle.
I doubt he'll interpret it that way.
Matt, did you take any drugs this morning?
Pencils down.
Can you squeeze my fingers for me? Did anyone give you anything to help with the math test? Matt?
I told you, he doesn't take drugs.
Miss Davis, all parents think that about their children. And they're usually wrong. I gave my mum a little trouble when I was his age. I turned out okay. Even she thought so.
I know my kid. The fact that you did drugs doesn't mean he did.
Did he go anywhere last night?
No. He was home studying.
Any friends come over to help him?
And bring him drugs? Is that what your friends did?
Miss Davis.
Look. I tested him myself. The home kit. I took some hair off his brush. I didn't want him to know about it because I do trust him.
Then why did you test him?
All he did last night was study and argue about his college interviews. He wants to be himself. No haircut, ratty old clothes. That'll go over big. Then we both gave up and went to bed. That's it.
Has he ever had any problems like this before? Any family history?
No. It's just me and Matt.
Diazepam, 10 milligrams, start.
Right, what's going on?
Taking some precautions. He's seizing. The poison's called disulfoton. This should bond with it and neutralize the poison. Then his nervous system will start sending the correct signals to the rest of his body.
But there was no well, that stuff in that can.
The label says disulfoton. I can show you.
But you didn't test it.
You said Matt sprayed with it this morning before school.
Matt started that garden himself for an environmental science class. They weren't allowed to use pesticides.
Apparently he cheated a little.
It was orange peel oil, totally organic. He dumped that other stuff last winter.
The symptoms fit. There must have been some left in the can.
If you're wrong, what will this treatment do to him?
Well, theoretically, it could increase the toxicity and... But we're not wrong.
Don't.
We're not wrong.
I can't let you do this.
Get a court order. Unless you want to see someone killed by sheer irrationality.
Maternal instinct is always irrational. Doesn't mean it's wrong.
Actually, that's the definition.
It doesn't make her mentally incompetent.
She is risking her son's life based on a teenager's claim that he washed something. How mentally incompetent can you get?
That's a brilliant legal argument.
Listen, have your Harvard law dog whip up some high-grade legal-sounding psychobabble. Temporary insanity brought on by acute panic distress syndrome. I don't care. We have to give him the hydrolase.
Her only sign of mental illness is that she disagrees with you. Some would consider that a sign of sanity.
Not the kid. Let's ask him. Oh, no, I forgot. We can't. He's dying.
Get the mother to sign off that she's refusing this treatment.
Goodbye. I, Margot Davis, have been informed of the risks which may arise from my refusal of advised medical care. I hereby release...
Who are you?
I work for the hospital. The Princeton Plainsboro Teaching Hospital and its employees, agents, and otherwise from any adverse medical conditions resulting from my refusal. It is not the hospital's fault if my son kicks off.
Kicks off?
I punched up the language, mostly for clarification. I understand my doctors consider my decision to be completely idiotic.
Why are you doing this?
But I am convinced I know more than they do. I took a biology course in high school. I assume that's... yeah. Besides, I enjoy controlling every single aspect of my son's life, even if it means his death. Sign here, please. I brought a pen.
Who are you?
I'm the doctor who's trying to save your son. You're the mom who's letting him die. Clarification. It's a beautiful thing.
My God, the things he said.
Dr. House wanted your son to get the medicine he needed. He was willing to do whatever it took to make that happen.
The wrong kind of medicine.
He didn't know that. At the time, it was our only choice.
He would have known if he had listened to me.
He listened. He just assumed you were wrong. To be honest, that's true of most of our patients.
You're just as pompous and superior as he is.
The county's worried about West Nile, so they sprayed ethyl parathion right next to the bus route.
Do you have the hydrolase for ethyl parathion?
Yeah, only one problem. Matt's mother faxes records to the CDC. She refuses to let us do anything until she hears back from them.
Well, you're getting good at this godlike doctor racket. Why don't you talk her out of this lunacy?
She's not really a big fan of mine.
Or mine.
Well, only one man left in the bullpen, and he throws like a girl.
I hate sports metaphors.
Give her the high, hard one.
We really think the hydrolase is the only...
I'm thinking about transferring that out of here.
Miss Davis, your son is very sick. He won't survive a transfer.
I'm getting a second opinion from the Center for Disease Control.
Right. Look, when my grandmother got sick...
What? You're gonna tell me some tough decision you had to make?
I know how hard this is for you.
Maybe embroider the story a little, make it fit?
I can't imagine being in your position.
Honesty, a kind of vulnerable honesty. That's your thing. And the looks.
Boy.
They send a single woman to hustle the single mom.
Actually, they sent a doctor to tell you that if your son doesn't get this treatment, there's a good chance he'll die.
That's what House said about a treatment that would have killed Matt. You've got to do better than that.
No. It's on you. You need to do better. Right now. Yes or no?
I don't know.
Figure it out.
Wait.
I never bother to wash new clothes before I wear them.
Right. Your wife does. She likes you feeling nice and comfortable.
Hey, I'm a man. I don't have time for laundry. I'm saving lives here. No, she doesn't wash them either.
So your skin absorbs a little dye, the odd chemical here and there?
Well, you know me, Mr. Living on the Edge.
Judging by the self-importance of your strut, you have identified the chemical in question.
Fostrin.
Hit him with the hydrolase.
She's parents said yes, but
Mighty Mom said no. She's gonna feel like $1 million when she lives and her son dies. Send Cameron. She's the only one of you who's managed to talk her into anything.
Not this time. Matt's mum won't make a move until she gets that opinion from the CDC.
Godot would be faster.
What is this?
Thought I'd hang out. In case you change your mind. And I could give Matt the medicine right away. Don't worry, I've got time.
The CDC promised they'd call.
Yeah, I'm sure they will. Maybe tomorrow, maybe the day after. It takes time to review faxed records. And they'll probably tell you they can't make a decision based on faxed records. This is Susie. She's never gonna marry him. No money.
What makes you think you're right this time?
Same reason as last time. If you want to see how the other kid does first, that's okay. Might help you. Although there's a real good chance that
What? Matt might kick off?
it's a little blunt. I was gonna say run out of time, or just kind of let my voice trail off.
Hello? Yes, this is Margot Davis. But you have his records. I sent them. Yes, I understand. They can't help me.
They haven't seen him. They can't make a
Give it to
decision
him.
with it. You're not pregnant.
Well, I told you that. But there's got to be some other reason I'm still spotting.
Sure. You were pregnant. Based on your hormone levels, you've had a miscarriage.
I haven't even been on a date.
Right. Since it's physically impossible to have sex without someone buying you dinner.
I haven't had sex since I split up with my husband. That was almost a year ago.
Fine. Have it your way. Immaculate conception.
What do I do?
Well, it's obvious. Start a religion.
Petechial bruising? I don't know if I pronounced that right.
Gosh, the internet is such a wonderful tool.
It could be leukemia.
Definitely possible. The more likely diagnosis is hickey.
Well, it can't be a hickey.
Why is everybody so ashamed of sex all of a sudden?
I'm not having sex. I barely even thought about sex since my marriage. Ow!
I say you're having sex, you say you're not. Either you're lying or I'm wrong. Or there's some middle ground.
You mean like oral?
I mean you're having sex without knowing it. I'm testing you for booze, drugs, and GHB.
I don't drink. Or what's GHB?
The date rape drug. You have restored my faith in the human race. You're lying.
No, I'm not lying.
Just got your results back. No GHB, no nothing. Means you're having sex and you're lying about it.
No. And I have a new symptom. I have a rash on my butt. Do you wanna? Yeah. What is it?
It's a carpet burn.
No, it can't be. Doctor, I love sex. I miss it. I haven't had any in over a year.
Well, you managed to keep this appointment, so you have no short-term memory problem. Multiple personalities. You find yourself losing chunks of time. Did you wake up and you don't remember falling asleep?
No, I just wake up really exhausted.
Something upsetting you?
No. My ex lives in the apartment downstairs. He's always calling me, always wanting to get back together, complaining about mixed signals. Get out of my life. How much clearer can you get?
We have a sleep lab in the basement. If nothing else, it'll get you away from your ex for a night. These were your brain waves at 2:45 a.m. Here it comes. There's an abrupt jump from slow wave sleep. This indicates partial sleep arousal. The most common type is somnambulism, sleepwalking.
That would explain why I'm so tired when I wake up.
Yes, and also why you were pregnant. And the hickeys. And the carpet burn.
I had sex in my sleep.
Sexsomnia is a documented disorder. You said your ex lives downstairs.
I'll kill him.
Okay, but he probably didn't know that you were asleep. Sexsomniacs can act pretty normal. I'm gonna write you a prescription for a low-dose antidepressant. It'll let you sleep better. If you want to save yourself the $15 copay, you could have sex while you're awake.
He's my ex.
You live in the same building. You haven't had sex with anyone else for a year. You sleepwalk right into his arms. Call me crazy, but I'm sensing unresolved issues. Yow.
Fever. Does that mean I have it?
You have a rash? Come on.
It's from my new bathing suit. I've had it a week.
Yeah. Does your neck hurt? If it does, you hit the trifecta.
It's nothing. I pulled it trying to do a 3.5 tuck.
Where are your parents?
We live in Chicago. I'm here with my coach. I wanted to see what you were writing.
Go like this. Not like this.
Maybe something systemic.
Or maybe it's meningitis.
She's had the rash a week. If it was this meningitis, she'd be dead by now.
You guys figure we're done down there? The 800 people milling around are just waiting for the bathroom?
12-year-old female. Fever, rash, neck pain. It's not meningitis.
It's the definition of meningitis.
Sure. Pus in the spinal canal makes it hurt to move your head up and down, but her neck only hurts moving side to side.
Or side to side.
Doesn't fit.
The three of you lobby now.
Those little pills you're passing out so efficiently aren't going to do Miss Leganis squat.
You just don't want to deal with the epidemic.
That's right. I'm subjecting a 12-year-old to a battery of dangerous and invasive tests to avoid being bored. Okay, maybe I would do that, but I'm not. It turns out she's got meningitis. You're right, you win. But if we go back downstairs and she dies, your face will be so red.
You have 1 hour.
Hey. Hey. You okay? How's your head feeling?
She's got a headache and she's dizzy.
She shouldn't have been moved after the procedure. I'm sorry.
Fine. What did the test show?
No meningitis and no other infections.
But you're not carrying a blue form. something else, don't I?
Something's causing you symptoms. We're gonna keep you here overnight. I know it's a little crazy in here, but hopefully you'll settle down and we'll be able to get you a room.
I'm sorry. I'm not usually all emotional like this.
You're doing great. Your folks land in a few hours.
I haven't slept. I'm so tired. Oh my God, my eye's bleeding. What is it? What's happening?
Oh, don't worry. The antibiotic we gave you in case you had meningitis can turn your tears reddish. That's not blood. That's blood.
So when do they think you're getting out of here?
I don't know.
You don't look sick. Better hope you're not. This equipment looks like it's 100 years old.
Just got it out of storage. It is the previous generation, but it works just fine. Could you guys give us a sec?
If it's good news, you can tell them.
Okay. We're pretty sure it's not cancer.
Hey, that's great.
I'll call your parents.
Well, we still can't release her. We still don't know yet exactly what's causing the... Oops. Mary?
What's wrong?
She's having an absence seizure. Mary, you okay?
She looks fine.
I need some help over here. Push 2 milligrams. Ativan, stat.
Are you sure it was an absence seizure?
Absolutely. She was totally unresponsive and unaware of what was going on around her.
Do you mind? We're trying to work.
We should get back out there. Cuddy's gonna be looking for us.
Looking but not finding. Did you do an EEG?
Seizure frequency is increasing. They're almost constant now, 5 in the last half hour.
Which tells us...
It's definitely in the brain.
And it's getting worse.
And? Good Lord. Are you having a bowel movement or a baby?
Could be barbiturate withdrawal.
Nah, can't be drugs. She's tested at every meet she competes at.
A bleed in the brain could cause seizures.
Rat poison. Could also cause the neck pain.
You think she's eating off the floor of a folks' garage?
Doesn't have to be.
Who would poison a 12-year-old?
Well, let's see now. There's the 18-year-old has-been that she beat out to make nationals, the has-been's parents, jealous siblings, sociopathic swim fan, and then there's just your plain old garden variety whack job. Hey, you know what a hemorrhoid is?
No.
Well, Google it. And try some Raisin Bran instead of the donuts. Okay, do a CT scan, check for intracranial bleeding.
Not a chance. Radiology's totally swamped.
If our patient's bleeding into her brain, she's gonna be dead in 8 hours.
She could be, but a meningitis patient will be without a CT scan.
When I was in med school, I had this old professor.
Who touched you in the naughty place?
Before the CT scan was introduced, he specialized in transcranial ultrasound.
Ancient, but if there's enough bleeding, it might work. Okay, do what the guy who didn't specialize in neurology said.
It was my idea.
You're right. There's a significant bleed in her temporal lobe.
But no poisons. Did tox screens on her blood, urine, and hair. Nothing. Did them twice.
He's a little dehydrated. Put him on a saline drip and give him some orange juice.
I need an operating room and a neurosurgeon.
Oh, well, given the current crisis, I'm tempted to say no, but since you've been so sweet to me
Our
today...
little mermaid is bleeding into her temporal lobe.
How fast are you never prepped?
20 minutes.
You'll have a surgeon in the room in 10.
Got both on board.
We're missing something.
What?
If I knew that, it wouldn't be missing.
Maybe she's adopted and we've got the wrong history.
No, she's got her mom's eyes and a red patch of hair, just like Dad.
What about an allergic reaction?
Could explain the rash and muscle pain, but probably not the bleeding or seizures.
That's a lot of balloons.
You think she's allergic to polyester?
Not unless she's been competing in the nude all these years.
Then what are you thinking? What do the balloons mean?
What if the rash is wasn't a rash.
What are you talking about?
Who gave her the balloons?
Some of the girls from her team. I've been visiting her pretty regularly, but none of them are sick.
What about the guys?
None of them are sick either.
Which guys visited her?
Actually, none.
She's cute. She's nice. She's a kick-ass diver. I think the guys would be falling over themselves to get close to her.
She's 12. The youngest guy on her team is 16.
Okay, so maybe they're just not interested. Or
They're avoiding her.
are there any cell fragments in her blood smears?
No. Red blood cells were intact.
Check him again.
Blood looks like it's been put through the blender now.
You done yet?
You were right. Rash wasn't a rash. She's bleeding into her skin. It's purpura.
Thrombotic thrombocytopenia purpura.
Starts with T. You were so close.
What could have set it off? She had no traces of E. coli in her culture. She's obviously not menopausal, so no estrogen.
There is one other possible cause.
Oh, God.
Pregnancy causes all kinds of chemical and biological changes in a woman's body. Or a girl's body, as the case may be. In extremely rare cases, everything goes haywire. It's called TTP. Blood starts clotting like crazy and clogs the vessels in your brain and kidneys. Red blood cells end up getting shredded as they squeeze past the clot like a fat guy in a crowded bar. I'm sure you know what that's like. I mean, you're only 12, but you're all grown up, right? Travel on your own, hang out in hotel rooms, getting room service with your teammates. Maybe someone sneaks in a couple of beers, start playing spin the bottle. Next thing you know, you're waking up with nothing on but your socks.
It wasn't like that.
Of course not. You wanted it.
Yeah, I did. He turned out to be a jerk, but
Actually, under New Jersey law, the term is felon.
I knew what I was doing.
We're gonna have to do something called plasmapheresis. It cleans the antibodies from your blood. We're also gonna have to terminate the pregnancy.
You gonna tell my parents?
Someone should.